Right. I'm off.
Can you watch Sophie for a second?
She's fine.
Oh, please, please.
What are you doing?
I just need a wee. Thanks.
Where's my bike lock?
Hey, I'm at the camps all day, so you're gonna have to come there.
Sorry?
For our meeting.
Oh, right, yeah.
3 o'clock, all right?
Yeah, works for me.
See you at 3. Hey.
Melody.
I can't stop.
No, listen.
I've got to sort out all this probationary stuff for Nick.
What are you up to, Ro? You don't need these.
I know. I'm sorry.
Look, doctors hand them out because it's easy for them. Pills aren't going to get you back to normal.
I haven't taken many.
If you got out a bit more.
I do.
But without me, I mean just you and Sophie. What about the mother and toddlers group that meets at the church?
I don't know any of the people.
Well, neither did they till they joined. The woman who runs it's really nice, Kathy. I've told her all about you. I could take you in. Stay for a bit.
Kathy? Okay, I'll find her. You don't need to come in with me.
About Daniel's GMC report.
Oh, all done?
Yes, I've nearly finished it. I just, there's a couple of tweaks that I want to make. I'll have it with you by the end of the day, though.
Good, yep. Everything okay?
Yes, his attitude's great, cares about his patients. That's just, the work side, though. I'm not sure how he's coping without Joe.
What do you mean?
Well, rattling around that big old house by himself, no one to talk to.
Did I ask you to do an assessment on his personal life?
No.
Well, I'm sorry, but Daniel's had more than his fair share of support.
Well, if you'd had that attitude when I was falling apart...
You're a friend.
Yeah, and Daniel is my friend.
Hello, this is Rowena Martin. Is it possible to speak to Dr. West?
Rowena? You okay?
No, not really.
Can you tell me about it?
I just don't feel very good. I was wondering if you could come out.
I can't today. I'm the only doctor on duty.
Oh.
Do you think you could come here?
No.
So, how's the medication?
I accidentally threw it out.
Accidentally?
Yeah. Not really sure that it was helping, though.
Have you had another panic attack?
No. But I haven't really been out since you came here.
So you're going to need another prescription? Okay. I'm going to add you to Dr. Clay's house calls list.
Hey.
Hi.
Melody.
Oh, I don't want to know.
What?
Well, it's obviously about JJ. You know, that concerned voice you put on, it's really annoying.
Well, I'm sorry if I sound concerned.
He's a normal young guy doing normal guy things.
He is dealing drugs from your home.
Oh, here we go.
I was there yesterday.
After I specifically asked you not to go.
Did you not just hear what I said?
Look, he would not be dealing, OK? Archie, whatever grisly little scenario your brain has dreamt up, JJ wouldn't do that.
I am not lying.
And I am not even having this conversation. Like we said, while JJ is around, you and I are on a break.
Fine.
You're back.
I looked for you at Mothers and Toddlers.
It was Sophie. We were all ready to go out and she sticked up everywhere. Had to give her a bath, change her completely. By then there was no point, really.
Is she all right?
Okay, yeah, she's fine now. That's the doctor.
The doctor? You just said that she was...
Yeah, I know. I called him for me.
What do you mean it won't fit through the door? How did it get in the room in the first place? Yeah, but don't the legs just unscrew? Look, Eva, I've got to go, okay? Just don't let them saw anything off. I'm moving house.
Nightmare. Did it last year. Never again.
Dr. Clay.
Sid Martin, you're actually seeing my wife. Come through. This is Dr. Clay.
Hello, Rowena. You've been seeing Dr. West, is that right? And he's been treating you for...
This is the problem.
It's since I've had the baby. I just don't feel right.
It was a difficult birth. Quite a few complications.
No, I'm all right though now. It's not that. It's other stuff.
How do you mean?
Oh, well, she's been getting quite worked up recently. It's nothing in particular. It's just turned into a sort of cycle. She says her heart starts to race. She breaks out in a sweat. It only ever happens when I'm not here.
And how are you sleeping?
She's quite restless.
I'm listening for the baby.
Can I examine you?
Yeah.
Yeah.
Hey, JJ, it's me.
Hey.
What are you doing later? For lunch?
Oh, I don't know. Don't really fancy anything.
Oh, go on. My treat.
Nah, I don't really feel like eating out, you know?
Are you all right? Turning down free nosh?
Funny. I'll see you when you get back.
Oh, okay. Have a good day.
Well?
Well, your heart rate is slightly high. Has Dr. West ever discussed thyroid problems?
No.
Thyroid?
Yeah, it's a gland which produces hormones that control the rate of metabolism.
Right.
Well, it's possible that the thyroid is overfunctioning, producing too much hormone. It could be triggered by pregnancy.
Is it treatable?
Yes, sometimes with medication. Depends on the cause and the severity of the symptoms. I think the best thing we can do is to arrange a blood test and then take it from there.
So why didn't Dr. West pick up on it before?
He said my heart rate was normal.
Well, the symptoms can change from day to day.
Well, at least we're getting somewhere now.
Patient no longer at this address. House full of students. Didn't have a clue.
Okay, I'll look into it.
Thanks.
Hey, I thought you'd be buried under cardboard boxes.
Are you kidding? I got a company and thought it was best to leave Eva in charge.
Oh, poor removal men.
Yeah, well, she can make bacon sarnies with the best of them.
Really?
Nah. I did suggest it, but she said they were lucky to get a digestive.
Hey.
Hey.
Actually, I'm with Miss Marson.
Yeah, fine.
Let's give her a script.
No, I think she might have hypothyroidism. Well, the symptoms fit sweating, palpitations.
She's got an anxiety disorder. She has a palpitation because she gets into a state of panic. It's got so bad she can't leave the house.
Oh.
All you needed to do was give her a prescription.
Yeah, well, she never mentioned the anxiety.
Should have picked it up.
I'm not a psychic, and her husband said...
Her husband was there.
Yeah.
You know, all this domestic bliss is addling your brain.
It all fits. Everything the doctor said. I've been checking it out on the web. We should have known there was something wrong with you.
It's not definite yet.
Yeah, but it explains all the symptoms. Hey, you probably had it all the way through pregnancy. We just didn't notice. And Dr. Clay says it can be treated.
I thought you didn't like them handing out all those pills.
Ro, this is proper medication. Completely different to whatever else you were on. So, you don't need to stay here. Going round the bend. Come on, you need to get out and about more.
Not now, I'm cooking.
It's a lovely day.
Tomorrow, I promise.
But let's go to the park.
Sid.
Up for the baby, Ro. I don't like it being cooped up in here all the time.
He'll be with us.
Yes.
There and back.
Look, it's a walk in the park. Not asking you to trek up Snowdon.
Okay. The reasons I should be living with you are numerous and threefold. 1, I'm 23 years old. I should be living away from home.
Hi.
2, I'm pregnant. I'd be an excellent babysitter.
What are you doing?
3,
Olivia,
you're
remember?
insane. Behold.
What's this? JJ?
Nothing.
Is everything all right in there?
I've seen cocaine before.
Tried to get my parents to look after him.
It's not mine, I had a mate round.
What mate?
You don't know him.
And you let him sit here and put that stuff up his nose, and that's normal behaviour now, isn't it?
No.
Don't talk to me like I'm stupid.
All right, whatever, I had a little hit.
A little hit. So how much is that? Did you do it every day?
No, I was bored.
I asked you to come for lunch.
Yeah, well, maybe. I don't want to keep sponging off you. Maybe I've got more pride than that. Oh, come on, Melly, don't be like this. You don't need to freak out.
Are you dealing?
What? Where the hell did you get that from?
Archie said he saw some people come round here and give you money.
Archie did he? Supercilious little creep. You're way too good for him.
I can't believe I didn't see it. Look, they're not sleeping and the mood swings in that football match. He said you played the second half like you were totally possessed.
Okay, I do a few lines, but I'm not a dealer.
Is that true?
You even have to ask.
It's the cocaine, JJ. It changes people.
Oh, you're such a drama queen. I'm not addicted. You really haven't got a clue.
Look at her. See how she's enjoying the sounds and smells?
I do stuff with it like that at home, you know.
I'm not criticising, I'm just saying. She needs to be experiencing new things every day. Yes, Ellie. OK. Yeah, give him a cup of tea and ask him to wait. Yeah, I'll be 10 minutes. I've got to go.
No.
Look, it's an old guy. He's just lost his wife. I've been trying to get him in for a chat for ages.
You can walk us back first.
I can't, it'll take too long. But please, Ro, don't be weird.
Okay, then.
You'll be fine.
You may think that you don't have a problem, but that's how it starts. Using it at weekends or at parties. But you're using it at a home, which means that you've crossed the line into habitual use.
Yeah, right, so how come you've only just noticed?
Oh, do you know what, JJ? You are spoilt and selfish, and if you can't see what you're doing to yourself, then think about Mum and Dad. Because the physical side of things isn't the worst of it by far. It's what the drug addiction turns you into. You lie to your family. You do anything for money. And all of those people who are trying to help you, you make their lives a misery as well.
Dr. West.
Hello?
Help me.
Rowena?
I can't breathe.
Where are you?
I'm dying.
You're not dying, Rowena. You're having a panic attack. And it's going to pass, and you're going to be all right. Just breathe.
I can't.
Where are you?
The park.
Where's the baby?
I can't see it. I can't move.
Okay. Just try and relax. I'm trying to get your husband, okay? Rowena, talk to me. Okay, I want you to focus on a time when you felt strong, you felt safe, everything was all right.
I'm sorry, but the person you called is not available.
I thought you'd have gone back to work.
How can I think about work?
Yeah, sorry. But you don't need to worry. I'm not like one of your loser patients.
No. And that's good. Because you're not going to have any problem giving up.
No, of course not.
You've got to. You know that, don't you?
Yeah, whatever.
I mean it, JJ. Either you stop now, or it gets out of control. And if it has already,
I told you.
then I'm going to be there for you. I'm going to help you. I'm not going to give up.
You're going to lock me in my room and feed me through the keyhole?
Look, it's your life. You do exactly what you want. I can't have you staying here, that's all.
Okay.
Okay, what?
I'll lay off the drugs. I'll be pure and healthy from now on. I probably won't even miss it.
Saw Julia this morning. We're all sorted with the GMC stuff.
Great.
Be a relief when it's all over, eh?
Yeah. Listen, thanks for the chat yesterday. I didn't realise how much time I spent talking about work.
Oh, that's all right. I'm the same. We spend so much time spouting on about the work-life balance to our patients, don't we? And make such a pig's ear of it ourselves, which is why I'm doing dinner on Friday night.
George, I really appreciate the offer, but I'm not sure it's such a good idea.
Why not?
Well, you know, me and Ronnie,
What?
we never really hit it off.
No, that's just Ronnie being Ronnie. He'll be fine.
Oh.
Rowena! Where are you? Rowena?
Rowena. It'll be all right. You look at me.
I'm sorry.
It's not your fault.
It is. It's useless. I can't do anything.
Rowena, you're ill. What you have is as real as me sitting in this chair.
So you mean I'm mad? I can't be mad. I can't do that to Sid.
Right, we should do one room at a time, unpack everything, then arrange it all before we move on.
Absolutely.
And anything we don't agree on can just stay in the boxes.
Maybe we should do a floor plan.
Yeah, maybe.
Well, to scale, of course. You know, with those little coloured squares we can jiggle around. You know, like that sexy bloke off the house programme.
I'm just trying to be organised.
Well, you crack on. I'll just make sure we've got something to eat for tea. Swear I've never seen half of this stuff before. What's that?
I don't know.
Well, it's not mine.
Garlic crusher?
Nah.
Nutcracker?
Nutcracker.
Just shove the lot in a drawer.
Well, that's not very feng shui.
No, leave it.
Mate, what your housewarming gift?
Oh, thanks. That's very thoughtful of you.
Yeah, suppose you're not really ready for visitors yet, are you?
No, it's fine. We've still got another 49 boxes left to unpack.
Actually, I need a bit of advice. You feeling better?
I wasn't faking.
I know. You're suffering from a temporary anxiety disorder, probably triggered by pregnancy and the stress of having a baby.
I wanted the baby. I shouldn't be stressed.
Rowena, 9 months ago, you were working full-time. A lot of women find it hard to adjust.
Why don't I meet any of them then?
You probably do. They've just developed a way of dealing with it. So, what happened in the park?
Same as when I had the attack before. I just got scared.
What else?
Something harming the baby. Oh no, it's stupid, but everywhere I look, there's just stuff waiting to happen. Like, the buggy could roll off and fall in the water. Or the boys playing cricket could whack a ball in her face. Or some man could just walk right up and take her.
It's called premonition of disaster. It's how anxiety disorder often manifests itself in their mums.
I do tell myself that I'm being irrational. And that she's safe, no one's going to hurt her. But then there's part of me. It's this little voice that knows that that's not actually true. Because he can never relax.
Does Sid know you feel like this?
No, not all of it. He's got enough to do. You don't understand. This job, it's a real step up for him, a real challenge. He's dealing with people's problems every day.
Go on, then, this better be good.
One of your mates is in trouble with the law, right?
Not yet.
Yeah, but they're heading that way. Look, let's get this straight. I don't deal with any of that confidentiality rubbish. Whatever you say to me, I'll file in here, OK?
So what's your mate then?
He's got a friend staying who's dealing drugs.
What sort of drugs?
Coke.
Well, get him out straight away.
It's complicated.
Was your mate using as well?
No way. I think he just feels responsible for the other guy. Basically, what I need to know is that if the police were to get involved, what would happen?
Well, if they find Class A drugs at your mate's address, there's a good chance he could be arrested.
Even though it's not his stuff?
But it's misuse of premises. There's no other way around it. Your mate needs to sort himself out, or he could be arrested, charged, even end up with a criminal record.
Which would screw his life right up.
Yep. Education, travel, career choice. There's a lot of jobs nowadays that won't touch anyone with a drugs conviction.
What does your mate do?
She's a doctor.
Panic attacks? I didn't realise it was that bad.
It's hard enough to come to terms with. I'm not going to explain.
This is only the third time.
I still should have noticed.
No, it's my fault for not saying.
But it's not like I give you the chance.
Sid.
No, it's true. If you were one of my parishioners, it'd be simple. You'd talk, I'd listen. But all this time...
Rowena's explained you've got a lot on your plate.
No, I've been blocking it out. It's me that's let you down.
No. You mustn't blame yourself.
Look, it's okay. You need to talk about your feelings.
Yeah, it's not his fault, no. He can't help being like this. It's because of what he went through with his mum.
Sid?
I'm sorry, I shouldn't have said anything.
She had a breakdown. A depression, I suppose. No one ever really explained.
What happened?
She was in hospital for a long while. When she came home, she stayed in bed. It's all I remember of her, really. My father made us tell people she had a heart condition.
How old were you?
5 or 6. Started just after my brother was born.
Then it's not surprising that you reacted the way you have.
I'm not your mum, Sid. I'm gonna get better.
Is that true?
The treatment of mental disorders have moved on a lot in 20 years. And you being able to talk about it makes all the difference. And what I'd like to do is to refer Rowena to the mental health service.
Right.
They'll probably continue medication, look at lifestyle changes, and a course of therapy as well.
She won't be, admitted.
No. Sid, I'm never gonna leave you.
Hi, Melody.
No, I phoned the mill and they said that she went home at lunchtime and hasn't been back since. I can chase her if you want me to.
Don't worry.
Okay.
So does Melody know you're here?
We're hardly talking at the moment. She told me to back off.
Which is what you've done, right? We've got to keep you out of this.
Out of what?
You want to protect her, so the only way we can make absolute certain she doesn't get dragged in is to get the brother arrested as soon as possible.
What?
Look, we'll do it away from Melody's flat, but hopefully it'll be a minimum charge and it'll just shock him enough to clean up his act.
What do you mean? What sort of minimum charge?
Well, if it's possession and a first offence...
Oh, and you'll make sure of that?
Well, I can't guarantee anything, but if his name comes out on the grapevine, then the police can arrest him wherever they like.
I don't know, it just all seems a bit drastic. As far as I know, the police aren't onto him at all.
Yeah, they weren't. Sorry, mate.
Look, don't feel guilty. If he's dealing Class A's, it's only a matter of time.
And what if they arrest him at Melody's flat?
It won't be out of my hands. I won't have any control of what happens then.
Look, I need some time to think about this.
Yeah, but while you're doing that, Melody could end up in a police cell tomorrow morning if she knows about the drugs.
Honestly, this has nothing to do with her.
Well, then let's make sure we keep it that way. Is there a pub nearby where I'm likely to find him?
If she ever found out this came from me...
She should be bloody pleased you care so much.
The Cellars. Bridge Street. JJ drinks there.
Liar! Liar! Please! Wait!
Police! Unless you can fit down the U-bend, you're not going anywhere.
I can't do this. I can't take it. Please, I need you.
Hey, what's happened?
It's JJ.
Dr. Sloan has trouble with a double next on BBC1 Scotland in Diagnosis Murder.